Hi everyone, I'm Dr. Eladio Montes, and now we're diving into neuroradiology of the frontal lobe. Frontal lobe lesions may not cause paralysis, but they can completely change what patients is. And that's exactly what they are so easy to miss and imagine. Many patients arrive awake, oriented, and walking normally, yet subtle frontal lobe injuries can lead to major changes in behavior, judgment, and personality. And if we don't recognize the frontal lobe correctly on MRI, this diagnosis can be delayed or overlooked. So, in this video, I'll show you how to identify the frontal lobe on MRI, which regions truly matter, and how to approach it in a simple, systematic way. Let's start with the basics. On an axial image, the frontal lobe is located anterior to the central sulcus. Everything in front of this sulcus belongs to the frontal lobe. The sagittal plane gives us the best overall perspective. Here, the frontal lobe extends from the frontal pole back to the central sulcus. Immediately anterior to the central sulcus is the placental gyrus, which corresponds to the primary motor cortex. More anteriorly, we find the prefrontal cortex, which plays a central role in executive function, planning, judgment, and behavior. Inferiorly, just above the orbits, it's the orbitofrontal cortex, a region particularly vulnerable to trauma and commonly associated with personality change. This is why frontal lobe lesions may not produce weakness, but instead present with disinhibition, apathy, or socially inappropriate behavior. These symptoms often only make sense when you understand exactly which frontal region is involved. The frontal lobe is not just anatomy, it is behavior, judgment, and personality. And understanding an MRI means understanding what a patient may no longer be the same person. For more neuroradiology explained through imaging, follow the next video.